Platte Valley Medical Center, our mission is to foster optimal health for all. To further that mission, we have adapted the Plaintree philosophy of patient-centered care. Welcome to the Patient's Voice as we continue to learn about personalizing, humanizing, and demystifying the patient care experience. Today, we'll take it one step further as we learn how every interaction is an opportunity to make a difference. High-quality interactions happen when we take the time to address the people around us in a warm and friendly manner, to help them feel welcomed and respected. For some of us, this requires a real effort to stop what we're doing and truly listen and respond to their needs.
Mr. G came to our emergency room, ended up having an emergency surgery in a couple days as an inpatient in our hospital.
I showed up here at the end of January with what I came to find out was an emergency appendectomy, that I had no insurance until the first week in February. So once I found out all the issues that were going on and the surgeries and everything they were going to be doing with me, I frankly was quite fearful of the cost.
The financial counselors spoke to him and attempted to get him help financially through programs with the state. But in reading his notes, I saw that he was only lapsed 1 month. So his lack of insurance weighed heavily on me.
Brenda, along with many others here, just from the very beginning said, don't worry about it, we'll work through it. And that was just amazing to hear.
He may very well apply or be qualified for COBRA. I came to work the next day, looked up the information on the internet as to the laws that apply to COBRA insurance, called him in his room, spoke to he and his family, and found that he had been recently divorced, could in fact qualify for COBRA. When I went up to his room, and I was actually out of breath when I got up there, I was kind of excited, I was able to explain to him the information on the insurance and how exactly he would qualify for COBRA.
I felt like Brenda listened in particular to our specific needs being a little bit more unique. Greg and I not being married, I felt like I had owed him, I had a responsibility to him and help figure out the insurance situation, knowing that we were probably right in between insurances.
It was very exciting to me to be able to help him out in turning a $25,000 hospital bill into approximately a $400 copay. Actually, his family told me it was a gift from God.
It was a good day. It was a beautiful day outside at the Healing Garden when we had a vendor come in making some kettle popcorn. So happened that it started to get windy, so he had called for assistance to relocate to the bistro where it was less windier, and helped him relocate all his table, all his equipment, his popcorn and so forth. His remark to me was, we don't get this kind of treatment anywhere we go. And my remark to him was, well, welcome to Platte Valley. This is what we do for you.
High-quality healthcare is greatly enhanced when we're able to explain things in a way that others can truly understand. It's easy to overwhelm others when we use a lot of medical terminology and catchphrases. When in doubt, assume the person you're talking to has no knowledge of what you're discussing. As you can see, we already do this so well.
So I had a patient who was complaining to me, and so was his family, that they felt they didn't understand the patient's diagnosis. The patient was his wife. In asking them what do they understand, they told me that they understood her to have a collection of fluid around the heart, which was not the diagnosis she had, which was congestive heart failure. So he was a retired farmer. He had used irrigation ditches and understood hydraulic pressures and that sort of thing. And so I explained this, that if you had an irrigation ditch and your pump fails or is too small for the job, you're going to have water backing up and overflowing. It's similar in the heart, except that the vessels are a closed system, and they're really coming through tubes that the vessels are water resistant, not waterproof. And so when we increase those pressures, because the pump, which is the heart, cannot handle the load coming in, those vessels begin to leak. And the easiest place for them to leak is into the lung beds, and that is why she has fluid in her lungs, not necessarily a collection around the heart. After I was done explaining it to them, the family thanked me. I can remember a professor in college who did, as we were taught in nursing school, to always link new knowledge to current knowledge as a way to help people understand the new information. And it made such a difference for me. And I try to remember that with my patients so that I can explain issues to them in a way that makes them understand the topic and feel comfortable with the information they have. I hope it makes as big a difference for them as it did for me.
So I'm DJ, the biomed on site, and my role is just in fixing and repairing and troubleshooting all medical equipment top to bottom in the hospital. First and foremost, I listen to people first, get a feel for what they are trying to talk to me about, what issues they have. Communication is important to me because the staff, they don't always know what's going on with these machines, and so it's my job to just kind of take over, listen to what their needs are, and just solve it. The staff at Platte Valley, they're phenomenal. They care a lot about the patients, and they want everything running ideal and smooth so they can really focus on the patient care, and that's what it comes down to. Because if they're having problems with the equipment, they're not being able to focus on the patient. So that's where I come in, and I make sure that it's seamless between the physicians and the nurses with the equipment, so they can deliver the best patient care.
High-quality healthcare happens when we make every interaction count. Great listening is often key to these interactions. As you'll see, listening can make all the difference.
We were in the OR, we had just delivered twins, and the mom started to hemorrhage. So I called the lab, and I knew I needed blood right away, so I told them my name, where I was, the patient's name, the medical record number, and told them I needed 2 units right away. We instituted the emergency blood plan.
When Susan called, I could tell that she was urgent with her request. Went to the checklist and started filling out what I needed to know. She called and said, yes, I think we're going to need it. I said, do you want an emergency released, or do you want us to, set it aside? I think once we get through the checklist, they're like, okay, now I can get off the phone and get back to work. And that's one of the things that we realize, us not being on the floor, we have our own things that we need to do down here, and the nurses have what they need to do upstairs. In terms of communication, that was a big part of saying, do you need blood now or not? Because the blood units can only be out of the lab for so long.
And the blood came up right away, so we were able to save the patient.
It was a day like any other when I entered the patient's room to empty the trash, and I noticed a man sitting up in bed. I could see that he was in a lot of pain and not feeling very well. I could tell from his facial expressions, his voice, and how he was speaking that he wanted to talk. I stopped what I was doing and I sat beside him and just listened to him talk about how he felt what had happened. I touched the foot of the bed and then patted his feet lightly. After a while, I could see that he was beginning to feel better. He thanked me for listening to him, and I tried to tell him as best as I could some comforting words so he could feel better. I felt very good that I could help that patient feel better because he was very depressed, very sad, and I was so glad that I could be there at that moment to listen to him and spend a few minutes with him.
Would you like your egg and cheese bagel? The usual? Yeah? Yes. Okay.
Thank you.
I try to give people their specialty or what they prefer for breakfast, their name. They kind of take ownership of it, and it seems they enjoy that. Like, I just made the Monica for her.
May I get my usual, please?
Yes, your omelet with mushrooms, peppers, and tomatoes.
Yes, sir.
Okay.
Thank you.
You're welcome. Here you go, ma'am. Enjoy your breakfast.
Thank you, Jim. Have a great day.
You too. Here you go, sir.
Oh, looks great. Thanks a lot, Jim.
You have a good day now. Bye.
He's on the ball with everybody. He's pleasant. He always has a good thing to say about people.
Mark usually gets fruit and oatmeal. Bruce over there usually just gets coffee in the morning. Willie, sometimes he'll have scrambled eggs and sometimes he'll have blueberry pancake. Here you go, here's your soft tortilla, refried beans, white cheese, and I give you a little American cheese too. Make it a combo.
Always very friendly and willing to make whatever I ask. Very nice.
Jim always has very good customer service. He's always friendly to patrons and always friendly to employees and always has something nice to say every morning when we come get breakfast.
I think it's salad.
As you can see from these inspiring examples, every interaction is an opportunity. Thank you for positively contributing to our achievements as a Joint Commission top-performing hospital. We already know we do things well here. Our challenge now is, how can we do things even better?